Welcome to IVF Family Building, where fertility treatment is explained in calm, plain English. This video is educational only. It is not medical, legal, financial, or mental health advice. Please talk with qualified professionals about your situation. If you are starting IVF, the biggest surprise is often this. IVF is not one appointment. It is a process with several decision points. Here's the simple timeline from first consult to pregnancy test. Step 1 is the first consult. This is where your clinic learns your goals, medical history, family structure, age, prior pregnancies, sperm source, eggs, uterus, insurance situation, and timeline. For LGBTQ+ intended parents, this may also include donor sperm, donor eggs, reciprocal IVF, or a gestational carrier conversation. Step 2 is testing. Your doctor may discuss blood work, ultrasound, ovarian reserve testing, semen analysis, infectious disease screening, genetic carrier screening, uterus evaluation, and records from prior treatment. The goal is to choose a plan based on facts, not guesswork. Step 3 is stimulation planning. If you move forward with IVF using eggs from you or your partner, medications may be used to help multiple follicles grow. During this phase, the clinic monitors progress with blood work and ultrasound. The timing matters because the goal is to retrieve eggs when they are ready. Step 4 is the trigger and egg retrieval. When the clinic decides the timing is right, a trigger shot is used. Egg retrieval is a short procedure where eggs are collected. Not every follicle contains an egg. Not every mature egg fertilizes. This is why clinics track numbers at each step. Step 5 is fertilization and embryo development. Eggs may be fertilized in the lab by adding sperm to eggs or by ICSI, where one sperm is injected into one egg. Embryos are watched as they develop. Some embryos may continue growing and others may stop. This part can be emotionally difficult because the numbers can change quickly. Step 6 is transfer planning. Some people do a fresh embryo transfer, others freeze embryos and plan a frozen transfer later. Your doctor may discuss embryo quality, genetic testing, medical history, hormone preparation, and whether single embryo transfer is recommended to reduce multiple pregnancy risk. Step 7 is embryo transfer. In simple terms, an embryo is placed into the uterus using a thin catheter. It is a hopeful moment, but it is not a guarantee. Your clinic should explain what to do afterward and when to test. Step 8 is the pregnancy test. The wait after transfer can feel endless. Symptoms can be caused by medication, hormones, stress, or pregnancy, so they are not a reliable answer by themselves. The blood test is the clearest next step. Before you start, ask your clinic for 3 things: a written timeline, a written cost estimate, and a plain English explanation of what happens if Plan A does not work. And remember this: needing help to build your family does not make your family less real. Learning the steps helps you ask better questions and feel less lost. Subscribe to IVF Family Building for inclusive fertility education for every path to family.